Hey everybody, it's Paul Barrett, the owner of the Modern Medicare Agency right here in Melville, New York. For the last 17 years, we've been specializing in helping folks with Medicare, and today we wanted to share a story about one of our clients. Her name is Betty. She was referred to me recently from one of my other clients. They actually worked together for several years. And the long and short of the story is very simple. Betty's a super sweet lady, the type of person that will never question anybody, just kind of goes along with it. So she's retiring from nursing. She gets a phone call from her financial planner because she wants to set up an appointment and find out about her IRA and other business. And while they're having a conversation, she tells him she's getting ready to get on Medicare. She doesn't have any retirement benefits. So he says, "Oh, Medicare, that's easy. I do Medicare." So she says, "Great." So the financial planner signs her up for United Healthcare plan, the most expensive plan that they have, the most comprehensive plan that they have, and he also signs her up for the most expensive drug plan and the most ridiculously expensive drug plan that they have. Okay, now that may be great for some people. It's very simple. It's kind of like the no-brainer way of doing it. If you get a Medicare supplement, if you're not aware, Medicare supplements are very easy to use. Any doctor that accepts Medicare, any hospital that accepts Medicare, there's no referrals, no prior authorizations. And if you pay the expensive premium, there's very little out of pocket. It's just the monthly premium that's going to happen. So it's very easy to explain. So a lot of people that are into financial planning like those plans because they tend to have more higher net worth clients. And most people do want those plans with higher net worth, but not everybody. And Betty was one of the people that was a not everybody. Okay. She did do some saving. She did have some money, but she didn't have a lot of extra cash. She was fairly healthy, barely went to the doctors, only took a handful of prescriptions. And as it turned out, she was having problems transitioning, paying her rent and all of her other bills. And, she came to me and was wondering, is there any way I could lower this monthly premium? So we take a look at all of our doctors, we take a look at all of our prescriptions, we put everything into the system. When we find out, that she will qualify for a much lower Part D plan that'll give her good coverage and save her about $80 a month, just on the monthly premium alone. All of her prescriptions were still going to cost her nothing because they were all Tier 1 generic drugs, and she was very happy about that. She also thought, maybe I should get a Medicare Advantage plan. A few of my friends have them. I know I hear bad things about them, but some people say good things. So anyway, we look up all of her doctors. She worked for a hospital, so naturally all of her doctors were in that same network. And it turns out that the network worked with Humana, worked with Cigna, it worked with Blue Cross, it worked with Aetna. So she had lots of choices after we looked up the doctors and the medications and see which plan was going to have the lowest copays, out-of-pocket expenses with the most freedom. Turned out she was able to get a plan for $0 a month, pay $0 for all of her prescriptions, have a $0 copay for her primary care doctor, and, modest copay for her specialist. She only had to pay $40. Yes, there were some copays that are definitely going to be higher, but paying $0 a month instead of paying $300 a month for her supplemental plan, when you weighed the two out, it turned out that it was a very beneficial move for her to choose a Medicare Advantage plan. Okay, and that's what she ended up deciding to do, realizing that she lived in New York too. If she needed to, she could switch back, at an open enrollment period to a Medicare supplement, or if there was a special election, whatever. But she knew she wasn't locked into it, and she liked the idea of paying as she went, so to speak, for her medical services, opposed to just giving $300 away every month when she only went to the doctors about 6 times a year. Okay, so just keep in mind when you're trying to decide which plan you want to get. Medicare advisors, we specialize in Medicare. This is what we do best. If you ask me about a 401k rollover, yes, I know a little bit about it, but no, I don't do it. Okay, I'm like the specialist. I'm going to only help you with Medicare. I have a network of people that I do refer my clients to that I trust, so I can send you to somebody that'll take care of your rollover. But when it comes to Medicare, you're not going to find people in most industries that are doing financial planning, property and casualty, life insurance, etc., that really are very knowledgeable and willing to do all the work to get all the certifications, to have all the options. they're going to take care of their clients for Medicare in the best possible way. So if you want help with your Medicare, if you have questions about Medicare supplements, Medicare Advantage, generally how to enroll, do you have to enroll? That's what we specialize in. Give us a call today at 631-358-5793. Hope you have a great day, and I look forward to speaking to you.